Hi there, I am Nicardipine, I am Nifedipine, and I am Verapamil. And we are the calcium channel blockers. Hello there, my generic name is Nicardipine, and my brand names are Carden and Carden SR, while my chemical name is this. I am classified into two, therapeutic classification and pharmacologic classification.
My therapeutic classification is anti-anginal and antihypertensive, where I reduce the consumption of oxygen in the myocardium or increase oxygen supply to the myocardium to prevent symptoms of angina or chest pain, and I lower the high blood pressure or treat high blood pressure. While my pharmacologic classification is calcium channel blockers, where I prevent calcium from entering the cells in the heart and arteries to contract. As a result, I relax the blood vessels and increase the supply of blood and oxygen to the heart, and I reduce the heart's workload and lower the blood pressure.
I am categorized as pregnancy category C because there are no adequate and well-controlled studies of me in the use of pregnant women.
My mechanism of action is I am a calcium channel blocker, where I inhibit the influx of extracellular calcium across the myocardial and vascular smooth muscle cell membranes. As I decrease the intracellular calcium, I also inhibit the contractile processes of the myocardial smooth muscle cells, causing dilation of the coronary and systemic arteries, increased oxygen delivery to the myocardial tissue, decreased total peripheral resistance, decreased systemic blood pressure, and decreased afterload. I am completely absorbed after oral administration. My absorption may be decreased if I am taken with food. I am subject to saturable first-pass metabolism, and my systemic bioavailability is about 35% following a 30 mg oral dose at steady state. I am distributed more than 95% bound to plasma proteins. I am extensively metabolized in the liver through the cytochrome P450 or CYP enzyme system, primarily by the CYP2C8, CYP2D6, and CYP3A4 isoforms. And I am excreted primarily in the bile and feces.
Nicardipine is indicated to hypertensive crisis. It is contraindicated in patients with hypersensitivity to the drug, in patients with advanced aortic stenosis, to patients who has angina, to patients with acute cerebral infarction and hemorrhage in the brain, to patients with low blood pressure, to patients with liver problems, to patients with chronic idiopathic constipation, chronic kidney disease stage 3B, chronic kidney diseases stage 4, and kidney disease with likely reduction in kidney function, to patients with allergy of calcium channel blocker and calcium channel blocking agents, dihydropyridines.
Hi there, my generic name is Nifedipine, and my brand names are Adalat CC, Afeditab CR, and Procardia XL. And my chemical name is this.
My therapeutic classification is anti-anginal and antihypertensive, just like Nicardipine. I either reduce the consumption of oxygen in the myocardium or increases oxygen supply to the myocardium to prevent symptoms of angina or chest pain. And I lower the high blood pressure or treat high blood pressure. While my pharmacologic classification is also calcium channel blockers, where I prevent calcium from entering the cells in the heart and arteries to contract. As a result, I relax the blood vessels and increase the supply of blood and oxygen to the heart, and I reduce the heart's workload and lower the blood pressure. My pregnancy category is also C, because the teratogenic potential is uncertain and the benefits if a pregnant woman will use me may be acceptable despite my potential risk. My mechanism of action is that I am a peripheral arterial vasodilator that acts directly on vascular smooth muscle. I bind to voltage-dependent and possibly receptor-operated channels in vascular smooth muscle where I inhibit the calcium influx through these channels. Stores of intracellular calcium in vascular smooth muscles are limited and dependent upon the influx of extracellular calcium for contraction to occur. As I reduce the calcium influx, it causes arterial vasodilation and decreased peripheral vascular resistance, which results in reduced arterial blood pressure and increases the supply of oxygen to the heart, and I alleviate angina or chest pain. I am completely absorbed after oral administration, and my bioavailability is 45 to 68%, partly due to first-pass metabolism. I am also a biopharmaceutics classification system class 2 drug, meaning I have low solubility and high intestinal permeability. I undergo significant tissue distribution in the steady-state volume of distribution, which is 0.62 to 0.77 liter per kilograms, is more than twice the volume of distribution of the central compartment, which is 0.25 to 0.29 liter per kilograms. I am predominantly metabolized by CYP3A4 to 2,6-dimethyl, 4, 2-nitrophenyl, 5-methoxycarbonyl, pyridine, 3-carboxylic acid, and then further metabolized to 2-hydroxymethyl pyridine carboxylic acid. I am also minorly metabolized to dehydronifedipine. I am 60 to 80% recovered in the urine as inactive water-soluble metabolites, and I am excreted in the feces in a metabolized form, most likely as a result of biliary excretion.
Nifedipine is indicated for prophylaxis of angina, hypertension, and Raynaud's phenomenon. The drug is contraindicated with patients with porphyria, to patients with skeletal muscle disorder, low blood pressure patients, patients with severe heart failure, acute coronary syndrome, and severe narrowed aortic valve, to patients with liver problems, to patients with chronic idiopathic constipation, narrowed intestines, and to patients with allergy of calcium blocker and calcium channel blocking agents, dihydropyridines.
Hey there! My generic name is Verapamil, and I have so many brand names such as
Isoptin SR, Calan SR, Covera HS, Isoptin, Isoptin 4, Calan, Verap, Verapamil SR, Verelan, and Verelan MP.
And my chemical name is this.
My therapeutic classification is anti-anginal, antiarrhythmics, antihypertensive, and vascular headache suppressants. While my pharmacologic classification is also calcium channel blockers, where I prevent calcium from entering the cells in the heart and arteries to contract. As a result, I relax the blood vessels and increase the supply of blood and oxygen to the heart, and I reduce the heart's workload and lower the blood pressure. My pregnancy category is also C, just like Nicardipine and Nifedipine. I am a calcium ion influx inhibitor, where I inhibit the calcium ion influx through slow channels into conductile and contractile myocardial cells and vascular smooth muscle cells. My inhibition will produce relaxation of coronary vascular smooth muscle as well as coronary vasodilation, which is helpful in patients with hypertension. I also increase the myocardial oxygen delivery, which helps patients with vasospastic angina. I correlate with negative chronotrophic effects and decrease in sympathetic nervous system activity. My antiarrhythmic effect as one of my therapeutic classifications appears due to my effect on the slow channel in cells of cardiac conductal system. I am absorbed more than 90% orally. My bioavailability ranges only from 20 to 30% due to rapid biotransformation following first-pass metabolism in the portal circulation. My absorption is rapid and my peak plasma concentration is reached 30 to 120 minutes following oral dose. I am widely distributed throughout body tissues. I am extensively metabolized by the liver with up to 80% of an administered dose subject to elimination via pre-systemic metabolism. I am also metabolized into two initial metabolites, such as Verapamil and D617, where these two metabolites are subject to further down via the cytochrome P450 system to form at least 3 additional metabolites. I am excreted by hepatic metabolism. Approximately 70% is excreted in the urine and 16% or more in the feces within 5 days. And I am excreted 3 to 4% as unchanged.
Verapamil is indicated to supraventricular tachycardia. It is contraindicated in patients with severe left ventricular dysfunction, hypotension, or cardiogenic shock. It is contraindicated to patients with sick sinus syndrome, patients with second or third degree AV block, to patients with atrial flutter or atrial fibrillation and an accessory bypass stroke, to patients with hypersensitivity to verapamil hydrochloride, and to patients receiving intravenous beta-adrenergic blocking drugs. The adverse effects of calcium channel blocker drugs to reproductive and endocrine systems are pain in the groin or genitals, abnormal ejaculation, decreased interest in sexual intercourse, inability to have or keep an erection, loss in sexual drive, swelling of the breasts, and swollen glands. To integumentary systems are bloating or swelling of the face, arms, hands, lower extremities, and upper extremities, chills, increased sweating, dry mouth, feeling unusually cold, itching, pinpoint red spots in the skin, skin rash, cracks in the skin, scaly skin, and severe sunburn. To cardiovascular and circulatory systems are blue lips and fingernails, chest pain, dilated neck veins, bleeding gums, blood in the eyes, bluish color, extra heartbeats, no blood pressure or pulse, snapping of the heart, unusual bleeding or bruising, bloody nose and heartburn, anemia, leukopenia, thrombocytopenia. To digestive systems, full feeling, diarrhea, and vomiting, acid or sour stomach, difficulty with swallowing. To gastrointestinal system are bloody stool, sore throat, excess air in the stomach or intestines, passing gas, difficulty in having bowel movement, difficulty with swallowing. To renal systems are dark urine, urine-contained blood, increased urge to urinate during the night, painful of difficulty in urination, and decreased urine output. To autonomic and peripheral nervous system are headache, dizziness, faintness or light headaches when getting up suddenly from lying or sitting position, general tiredness and weakness, nervousness, unconscious, mood changes, general feeling of discomfort or illness, trouble sleeping, fear, hair loss or thinning of hair, irritability, sleeping or drowsiness, tiredness, trouble concentrating and unable to sleep. To eyes and ears, dizziness, drowsiness, blurred vision, ringing in the ears, and disturbed equilibrium. To respiratory systems are cough, dyspnea, shortness of breath, labored or difficulty in breathing, coughing that sometimes produces a pink, fruity sputum, noisy breathing sometimes with wheezing. To immune systems are generalized weakness and infection. To muscular system, muscle stiffness, muscle tension or tightness, muscle pain or weakness, and body aches. And lastly, to skeletal system are leg joint stiffness. Before the treatment, the nurse should assess history of the patient for allergy to calcium channel blocker drugs, sick sinus syndrome, heat block, cardiogenic shock, hypotension, impaired hepatic or renal function and pregnancy. Obtain baseline data including skin color, edema orientation, reflexes, pulmonary rate, blood pressure, baseline electrocardiogram, peripheral perfusion, auscultation of adventitious sound, liver evaluation, normal outputs, renal function test, and urinalysis. The nurse should advise the patient to avoid grapefruit and juice during therapy. Caution patient to wear protective clothing and use sunscreen to prevent photosensitivity reactions. During treatment, the nurse should monitor the blood pressure during initiation and titration of dosage carefully. Hypotension with or without an increase in heart rate may occur, especially in patients who are hypertensive or who are already taking antihypertensive medication. The nurse should avoid too rapid reduction in either systolic or diastolic pressure during parenteral administration. Ensure that patients do not chew or avoid sustained release tablets. Protect drug from light and moisture. The nurse should advise the patient to take medication exactly as directed, even if feeling well. Take missed doses as soon as possible unless almost time for next dose. Caution patient to change position slowly to minimize orthostatic hypotension. Discontinue IV infusion if hypotension or tachycardia develop. Observe for a large peak and through differences in blood pressure. Initially measure blood pressure at peak effect and at through effect. After the medication, the nurse should instruct the patient to take sustained released form in the morning with food. Swallow it whole, do not cut, crush or chew it. Do not drink grapefruit juice while using the drug. Discuss to the patient that he/she may experience side effects such as nausea, vomiting, dizziness, sleepiness, emotional depression, or constipation. Instruct to the patient to report irregular heartbeat, shortness of breath, swelling of the hands and feet. Advise the patient to avoid driving or other activities requiring alertness until response to the medication is known. Instruct the patient to avoid concurrent use of alcohol or OTC medications, especially cold preparations, without consulting healthcare professionals. Instruct the patient on concurrent nitrate or beta blocker therapy to continue taking both medications as directed and use SL-nitroglycerin as needed for angina attacks. And lastly, advise patient to contact healthcare professionals if chest pain does not improve, worsens after therapy, or occurs with diaphoresis if shortness of breath or if persistent headache occurs.